truth is, we don't really know what high antibody levels against COVID really mean, whether it's after vaccination or after you've been infected and had the illness. There's not a lot of great understanding about what that means in terms of your level of protection, how long it might last, are you really protected? We're learning more and more, but for individuals who get a result because their doctor ordered a test, what to do with that result is not quite clear. When you get vaccinated, antibodies aren't the only thing the vaccine is making you do. Your antibodies are just one part of your immune system's response against any infection. And the vaccine, just like any infection, doesn't only stimulate that one response, it stimulates other parts of your immune system that we can't really measure with an easy test that also give you protection. So following levels and making decisions about how to decide about a booster or not is not a good way to go about taking care of yourselves. If you've had the primary vaccination series and or you've had COVID illness, but then tested positive for antibodies, I would not use that information to guide a decision about boosters. Really, boosters should be given irrespective of whether you have high antibody levels or not. And also, if you happen to have lower antibody levels or not very, or negative antibody levels, that doesn't necessarily mean you're not protected, because again, the vaccines and the boosters are not just making your body respond and protecting you by creating antibodies. There's other parts of your immune system that they stimulate, which also keep you protected. And you want all of that to be as high as possible and on a high alert as possible to protect yourself against potential exposure to COVID.